we think, where have I put my keys? I cannot find them. And we go, must be dementing. Well, actual fact, no. What you've done is not paid attention. It's not the same thing. Memory loss is more about not remembering what I had for dinner last night, not remembering the names of my loved ones, not remembering that the gas has been left on and I've burnt all my pots dry. So it's quite more significant memory loss, and it just starts with the little things, but over time it becomes bigger and bigger. So by the end of that memory loss, you actually can't remember very much at all. All the things, all the memories that you had, the names, the dates, the places, the people you love, that memory is actually gone. What does stay though is the memory of habit, the things that we've learnt by habit and practice. So we still remember how to brush our hair, brush our teeth, do up our buttons, ride a bicycle, but we won't remember to start that job off. We have to be encouraged to do it by somebody else. So we still can do the task, but we can't initiate the task. That's the part that the brain is damaged. So it's not just memory though, it's all parts of the brain that get affected. If we talk about Alzheimer's, we're talking about a loss of thousands and thousands, perhaps millions of cells. You've all seen pictures of the brain with Alzheimer's, how it's shrunk like a sultana. That's because of loss of cells. So if you think that the cells can only be seen under a massive big microscope, you're talking a lot of cells. So the front part of the brain, it controls our personality, who we are, our identity, the way we behave in public. It tells us not to swear. It tells us not to strip in public. It tells us not to grab somebody's breast as they walk past because they're good looking. Unfortunately, with dementia, some people lose those abilities to rein that impulse in. They also have personality change, and you might see them become angry really easily, or get quite depressed sometimes, or cry for no reason. Or the worst one of all is just sit on a chair for day after day and stare into space, which is called apathy, because that's the front part of the brain that's no longer working. The middle part of the brain is our parietal lobes, and they are our motor control. Now initially that's not affected by dementia, but a long way down the journey we actually lose our ability to walk, and we start to have falls because our coordination, which is from the cerebellum at the back of the brain, that starts to deteriorate and all the brain connections aren't working. The other thing the parietal lobe does is our spatial awareness and spatial concepts. So if the floor surface changes, you'll see somebody with very advanced dementia holding the door jamb and going like this, trying to get over the door, because the floor surface has changed and they can't interpret what it is, so they're frightened by it. Or the person starts peeing under the lemon tree or in the teacup in desperation, which I've seen, because the toilet is white, the tiles are white, the wall is white, and they can no longer see the toilet because it's completely gone to them, because their ability to work out space has been damaged. So it affects every part of the brain, and then eventually it is a terminal illness. We die because of it. But in the meantime, there's lots and lots of things you can do to help prevent dementia and also to slow down its trajectory. So the biggest risk factor is our lifestyle. Smoking, alcohol, high blood pressure, high cholesterol, lack of exercise, falls, all those sorts of things. Everything that impacts the heart is an organ in our body, so is our brain. So if our heart's got problems, our brain will have problems. So get yourself as fit as you can. Get out on the daily walk. Go and exercise, even with light weights. This training program is amazing, so continue to do that to help yourself stay well. The other really important thing you can do is mental stimulation, quizzes, Anything that gets that brain ticking over, maths problems, all those sorts of things, making recipes, continuing to cook. As many of those lifestyle activities that you've always done, continue to do them. Don't let people take that power away from you. It's really important to keep doing everything. One, to stay well, and two, to slow down the illness itself. And the most important thing is, and we've already mentioned it just a minute ago, is social connections. Social connections are absolutely vital. If you keep your connections up within your communities, it helps you to stay well. It stops depression, which is also a feature that can happen in dementia, but it also keeps those brain connections working. As you can imagine, the person who is talking to somebody else has to interact with all different parts of their brain. They've got to look at you, they've got to listen, they've got to understand what you're saying, which is in your temporal lobes. They've got to then formulate a response, which is another part of your brain. They've got to speak that response. And then they've got to switch their head between two different people talking. So there's lots and lots of skills involved. So social connections is absolutely vital for our well-being. So there's lots and lots of things you can do to continue to stay well. What terrifies people is people assume that the healthy brain may have signs of dementia. So what is the difference? It's very, very clear. Losing the keys, which I do every second day, going back to check whether I've locked it. I think I do that every single morning. That's because my brain is already at work and I'm not watching and I'm not paying attention. That's not dementia. That's just not paying attention. And if you don't attend to the task and you don't focus on it, you can't remember it. So put that aside. That's a complete myth.
That's right.
However, if the memory becomes quite noticeable, that it's disrupting everyday life, then you might have a problem. And it's all on handouts over there if you want, so you can help yourself to them later. Everybody makes occasional number errors, like calculation problems, but there's sometimes, it's not always. If you can't follow and remember instructions at all, then you know you've got a problem. If you do it occasionally because you haven't paid attention, that's okay. Remember, the ageing brain slows down a little anyway, actually quite a lot, I've noticed for me, but everybody's different. Sometimes an older person needs help with the phone, these newfangled iPhones, I don't know. You know, I'm not as old as a lot of you people, but they still do my head in. You know, the new technology, I have to learn. And yes, I'm not as quick as my 22-year-old daughter who just rolls her eyes at me, because we learn slower, and that's normal, okay? Expect things like that to take a bit longer. But when it becomes difficult with your normal everyday tasks, like you don't shower anymore, you haven't showered for a week, and it's smelly there and the hair looks a bit greasy, then you start to pay attention. Just struggling to learn those new things, it's okay. Confusion. All of us muddle up the days of the week or the date, but I know to look at my phone and I'm okay. I never remember the day of the week. I have to use my diary or I'm hopeless. But I know to look in my diary for that. But if you're routinely becoming confused about the day of the week and turning up at places on the wrong day, and it's becoming a bit of a pattern, and missing GP appointments and things like that, that's when you're starting to notice you've got a pattern happening here. It's a bit more to be concerned about. People's vision change as well. As we get older, our ageing eye is actually yellow. It's like looking through cellophane compared to a young person. And people become fearful of not seeing so well, and is that a sign of dementia? Actually, no, it's not. And the other thing that impacts our sight are cataracts, which puts that, that white milky film over the eye. That's age-related as well. So there are normal vision changes related to ageing. We all have them. It's nothing to worry about. But if you can't find that toilet because it's disappeared in that white space, I'd be a bit more concerned, okay? Everybody can't remember a word sometimes. The word's at the tip of my tongue. I know it is. I called Holly and Rebecca in reverse about 10 times this morning on my way here. I worked incredibly late last night, and this morning I just couldn't get it together, and I was calling Holly Rebecca and Rebecca Holly, and they thought I was hilarious. Doesn't mean I have dementia, it just means that the words are at the tip of my tongue and I'm not getting them right. That's normal. And that can be impacted by fatigue, pain, just being grumpy, having a headache that day, getting out of the wrong side of bed and so on. That's normal. People who have to go, where did I put that? And retrace my steps looking for my car keys. My reading glasses, I leave them everywhere. That's normal, okay? What's not normal is when they accuse other people of stealing said items and become quite paranoid about the things that are missing. And I have a client now who's has an intruder. She has some memory problems. We strongly suspect she's actually hidden her stuff because she's fearful of the intruder and she's forgotten where she's hidden them. So one day we'll find her purse. It will take a while. It may turn up or it may not because we don't know where she's hidden it. But, you know, she's now accusing the intruder of taking her things. But the security cameras are saying there's nobody there. So we know there's something going on. If you can't follow a conversation anymore, that's a warning sign too. Because as I said before, social connections take a lot of brain power. You will find that they'll just sit there and they'll look and they won't be following. And then out will come a random topic. My mum's living with dementia. I can tell when she's not following the conversation. We'll be talking about the weekend and then she'll say some random comment about something else completely irrelevant to facilitate her discussion. And we just go, huh? And we know then she's not following with us. We're actually outpacing her ability to keep track and swap from person to person. So that's a warning sign. Sometimes as we get older, we make dumb decisions, or others think we make dumb decisions. We always have a reason for our decisions. But if we consistently make bad, dangerous decisions, that's a different thing. That's to be worried about. Sometimes we get completely fed up with our obligations and don't want to know about it. I don't know, my dad has a doctor's appointment every single day of the week, I swear. Only one appointment can be on one day and he gets so weary of them, but he won't condense them up. Nope. And he gets so weary of them, that's normal. But if you pull back and you stay at home and you don't leave your house for week after week after week, and you don't join in all your past routine activities, that's something to worry about. Can you see the difference I'm showing you here? And of course you've got the personality and mood changes. So, dementia is quite different from the healthy ageing. Our brain doesn't do so well when we get older, but we manage. Keeping fit, social connections, that's the answer. When helping or supporting somebody with dementia, it's absolutely important that we don't disable them. We tend to try and mollycoddle them, protect them, wrap them in cotton wool, keep them safe, away from all evils. We want to love and protect them. Got to have that balance right, guys. By doing that, we take away their skills and abilities. They'll lose their skills and abilities much, much faster. So rather than saying, let me do it, yes, it might take a little bit longer, but work alongside them, help them, or even just use words to cue them in. Because remember, they'll know how to do the buttons up, but you might have to prompt them to actually start the task. Or you might have to prompt them to brush their hair. Sometimes as the dementia advances and the words become less meaningful, use the cue as well. And cues and gestures also help. And it's really, really important when you're supporting somebody with dementia, if you're feeling pissed off, They know. How much of our communication do you think is by words, and how much do you think is by our tone of voice, our cues, our gestures, and so on? Tell me what you think. What percentage?
I think the gestures probably outstrip the words.
How much is words?
Words are small compared to the actual.
Yeah, any percentage that you could name?
I would say probably 80% is our actual, even their words, because our words aren't just words. It's the way we say the words and when we say them and how loud we say them or how softly we say them. There's also many.
Yes.
And that's very
Yes,
communication.
that's correct, but it's actually more than that.
I believe it.
Yes, so only 7% of what we communicate is words. Everything else we say and do is facial expression, tone of voice, the rate of voice, our body language, cues, gestures, our huffing and puffing, our muscle tension, and so on. So if you can't put a smile on the dial, don't go. Just don't go. And ladies, it takes more muscles to frown than smile, less wrinkles. So if you're feeling a bit frustrated and a bit head up, it's really, really important before you approach your loved one who's living with dementia to take a deep breath and check yourself, okay? Because they don't understand that you're pissed off. They don't understand that they've asked you the same question 50 times because they can't remember. So take a deep breath. Make sure your shoulders drop. Make sure your tummy and chest is relaxed. Your fists are open, because there's nothing like wanting to, okay? And just relax your body language. Take that deep breath again, smile on the dial, and then walk in and speak calmly and slowly. Often it's our speech that makes it difficult for them to understand because we speak too fast. Yeah. Got your hand up the back.
Verona was close up. We call it you got yam.
Which means?
You got yam. H-U-M-P, hum.
Hum. What does that mean?
I'm a fellow of Britain. It means they really, like you said, pissed off.
Okay.
It's a British slang to say when you really got that hump that means you really.
Okay. That's my husband's British and my dad's British, and I've not heard that one. So
no.
Go figure. It must be a very select part of Britain.
The Queen's outside, not the real world.
That's a King's English.
Yeah. So, and as a carer yourself, look, it's very, very important because your loved one cannot understand what the problem is if you're not happy. They're forgotten. The second you step out of that room, they don't know anymore. But you will communicate to them that you're unhappy and they will not understand. It will just create more distress. So it's really important just to mellow down, as we like to say. But for yourselves, it's a long time. The average life, somebody say with Alzheimer's, is 5 to 8 years from the time of diagnosis till their passing. That's an average. Some people do really well, they live 15 years. Others will not, will live 3 or 4 years. Every single person with the diagnosis is very, very different. But on average, 5 to 8 years. So you're in for a long haul. So you have to be very mindful of looking after yourself. From the get-go, make sure you apply to My Aged Care, get your services in place. My mum hates people coming into the house. Dad for a while called them cleaners. And that caused all sorts of havoc because they didn't clean well enough and they were there to help with mum. And mum hated it. So it had to be explained to mum that if mum was to stay at home, dad needed support. Reluctantly, she accepts it. But you can use simple explanations, but it's really important. You get the cleaners in. You've got to let go of how immaculate your house might be. They don't do it as good, but they get it clean enough for you to live in. Get help with the garden, get help with the maintenance. When it becomes too difficult, get help with your loved one's personal care. And most important of all, have a group of friends around you to love and nurture you. Because dementia can be quite isolating. Like mental illness, you find out who your friends are. But get respite time, keep your hobbies up. Go out for your morning teas with your bestie. Do them regularly, because you need to look after yourself first. If you don't get to your GP appointment to get your blood pressure under control, or get to the dentist to get your fillings done, you can't look after anybody. So it's absolutely vital that you look after you first. People think that's selfish. No, it's not, because if you can't be there for that person can't continue to live at home with you. So number one is you, and then number two is your loved one who's living with dementia. I've probably gone on time now, have I? I've got no clock except for this one. Has anybody got any questions? Yeah.
I'm not sure if you are qualified to advise us on this, but perhaps you can try.
I'll tell you if I'm not.
What's the technology or the medical side of things that can help slow it down? What's the next news that you've got? Otherwise,
I'm actually doing my degree in dementia care at the moment, and that's the subject we've just finished studying. There is no cure. We have not found a cure, just putting it out there. All we can do is try and slow it down and control the symptoms. There are drugs called cognitive enhancers that you take in the very early phase of the dementia that increase the availability of some of the brain chemicals in your brain, which is the synapses or the connections between your brain. That is used in the early phases. You may have heard of Aricept or donepezil. They're the two of the drugs. There's actually three they're the main two that we use. There is a third, but rivastigmine, we don't seem to use that so much. What that can do is help your memory. The trick with this stuff is that the brain continues to change. The memory may stay in place for quite a long time, but the brain change continues behind it. So when they first take it, 1/3 will have a fantastic response to the drug, 1/3 will have such terrible side effects, and they're usually gastrointestinal or dizziness that they can't tolerate it. 1/3 will have no effect. So, you can try one drug and then try another and see if the different drugs help, but they can really give some people back their memory for quite a long time, a couple of years. The trick is though, if you stop this drug, your function catches up to where your brain is at. So it's a short-term fix, but it does give people a nice little window, 6 months to 2 years of having some retrievable memory again. In the middle stage of dementia, there's another class of drug that helps in a similar way for people with more advanced dementia. The other thing is we use psychiatric medication, so if somebody's aggressive, there are drugs to help with the aggression, or if they're verbally hostile or a bit paranoid, which can happen in that middle phase for some people, there's drugs along those lines, and also drugs for antidepressants and anxiety. There's no cure.
What about herbal medicine?
About
Herbal medicine.
hairball medicine.
Herbal.
Oh, herbal? No, no real efficacy. There is a lot of testing. The problem with the herbals is that there's no financial benefit for the pharmaceutical companies to test them. So there is very little research about the herbal ones. And you have to be very, very careful with the herbal ones because they do interact with, they're still a medicine, and they can interact or contradict the medications you're actually on. So if your loved one is taking herbal medication, you've got to tell the doctor. It's really, really important because you can cause very dangerous interactions. So there's not a lot of evidence at the moment about the herbal medications, unfortunately. There just isn't any research.
Well, I've got multiple sclerosis. I was
Yeah.
diagnosed in '96.
Yeah.
And I couldn't walk from here to there and crawl everywhere. Anyway, the whole thing is, I did take some steroids, but since then I haven't taken any medication. The only medication I took was sleeping tablets because I couldn't sleep on
Yeah.
them. The very mildest ones, but they would give me sort of suicidal thoughts and everything. So I really don't like to take pharmaceuticals because you just don't, especially when they interact with each other. So I take natural stuff because a lot of people don't realize, like, orange peel is 10 times better than the innards. It's the same with lemon peel. Because we squeeze the lemon and throw the best bit away. So really, like Spud was saying about he's talking about herbal natural stuff. There's so much, even our ancestors, that's how they overcame a lot of, and stopped them even happening and reversed them sometimes with eating orange peels or lemon peels or apple pips or something, you know, because a lot of, God doesn't make rubbish,
Yeah.
okay? And it's just that we're so used to squeezing the lemon and throwing the best part away, but it's 10 times better than the innards.
And you know, there needs to be research into all of this. It's just like things like being an OT, I look at my specialty area is behaviour management and supporting families with their loved ones. And things like if you have somebody with high anxiety and agitation and low mood, lavender.
Yes.
Lavender oil works a treat. It's the only one that's got any research behind it, and it actually crosses the blood-brain barrier and influences the brain chemistry. So if somebody's anxious or agitated or depressed, lavender is worth a trial, and also for insomnia. There is a little bit of evidence about lemon balm or melissa as an oil as well. I know a nursing home that swears by it. It stimulates appetite and it reduces agitation. But pharmaceutical companies won't research it because there's no money in it.
No money in it, that's the evil.
And researchers can't research it because they can't get it funded.
They
So
don't care about our health, they care about their wealth.
Yeah.
They care about we have to be our own psychologists, our own dietitians, we have to do research. Because nowadays, there's so many options, you can find credible evidence. Because I'm sorry to go back to lavender, but lavender keeps the mice away. My old granny used to have lavender there. I wondered what it was, but the fact is it keeps the mice away. If you have a lavender tree, the mice won't come near it.
oh, I didn't know
So
that
there
one.
you go.
There's my fact for today.
Safety fortune on mouse traps.
Yeah.
Yeah, there's so much in
There
natural
is-
things that we can do.
There
to
is
the body.
so much out
Yeah,
there.
yeah.
There is. If I came back in another life, I'd be a naturopath for that reason.
Oh, you can do both. You can do
Any
both.
other questions from others? Karen, there's one question I need to ask. How, when you meet a dementia patient, you know, the Asians like to, whenever we meet any people, have you eaten, you know, a greeting. So what do we say to dementia patients?
Exactly the same.
But they will not be able to answer us, right?
They can answer. Their speech disappears a long way down. So in the mild to moderate phases of dementia, they will understand you. There are certain types of dementia that are impacted by speech, and that's specifically some of the types of frontotemporal, which is only the frontal lobes and the speech centres of the brain. But they're much rarer forms of dementia. They're still around. For example, Bruce Willis, you know, the actor, I don't know, yeah, he's got frontotemporal dementia, and he's got the type that affects speech. Now he's already losing his functional speech. So
You got it very young, isn't it?
yeah, and that type of dementia tends to happen young. Yeah. Yeah.
Is that genetic?
If it's a young onset like that, it frequently is. Yeah.
Because you get a lot of young people getting
The younger onset usually have the road gene that causes it. Yeah. Yeah. But us older folk, no. It's just what's happening is it seems like there's a lot more dementia in the world, but it's all because we're living longer. Really, the percentage hasn't gone up. It's just the numbers have gone up because there's more of us.
Yeah, I heard that 10% of the population is going to die with dementia.
Yeah, it'll be a lot more than
Is
that
it
by
in Australia?
2050.
Is it Australia,
Yeah,
in Australia or
it's
worldwide?
going to be massive.
Yeah.
Yeah.
When it's genetic, how many generations before it can appear in that generation normally?
There are different genes. So some genes may increase your chance of getting dementia, but you won't necessarily. And it may involve environmental factors in your lifestyle as well as whether you trigger that process off. Some genes are protective and actually stop you from getting it, whereas other genes are rogue genes and they're inherited. But it depends which gene it is.
So that means when they have it, when they're very young, it's almost definite it's genetic.
Usually.
Even though it never ever appear in previous generations.
Yeah.
It can skip generation.
It can skip, but it might be a recessive gene, so it's only if it comes down.
So
Yeah.
elderly people, what do we have to do to not get this?
So, as I said before, stay socially connected, use that brain, do all your maths, calculations, quizzes, stay as independent as possible, and do these exercises. Absolutely. Exactly right. Limit your smoking, limit your alcohol.
We had a barbecue in the park the other week.
Yeah.
It was quite nice because the Chinese know how to cook. But then afterwards I told them, I said, let's go for a walk, and nobody wanted to do it. Only Pastor Jeremy and myself, we went for a little walk down the bottom.
Yes.
And came up the
We were
top.
dancing.
You have to
We were
walk
dancing.
before
Yeah,
eating.
that's exercise too. Yeah.
girls were dancing.
I think they're saying exercise before eat, not on the full belly.
Hi Karen, could you just let us know a little bit more about vascular dementia?
Yeah. Vascular dementia is the second most common type of dementia. It's that if you think about all the cardiovascular risk factors that we have for our heart and our lungs, the brain is affected the same way. So what vascular dementia is, used to be called multi-infarct dementia, and they've rebadged it in the last couple of years. What it is that the brain, the circulation to the brain has been impacted. It's usually the tiny, small blood vessels. It will show up on an MRI and a CAT scan. And what you have is at these ends of these tiny little blood vessels, you'll either have little blood clots or you'll have blockages, and the area in the immediate vicinity of the brain and the brain tissue dies, and it's just tiny little bits that get picked off. Some people may also have bigger strokes as well in combination. So it's very different. Alzheimer's is the entire brain, whereas vascular is only the bits that get hit. So the presentation can be very, very different. What we're actually finding now in the research, and it's obviously via autopsies, is that the most common type of dementia is actually mixed dementia now. So people will say they've got Alzheimer's, but later on we actually find they've got both vascular and Alzheimer's combined. That's the most common type. It's just because we live hard.
If we do like the exercise and don't smoke and all that sort of thing, socialize, is it sort of like a good guarantee? Or will it stop it, prevent it? Like,
It's
are you gonna
certainly,
get it, you're just gonna get it?
Slows it down.
it slows it down and it decreases the likelihood that you'll get it, because you may die of something else first.
I suppose it can delay it, because I know
It
somebody
can delay it,
who's got
definitely.
6 languages, lots of
still
musical
die one day.
instruments, but still got it.
Yeah.
The Chinese play a lot of mahjong, right?
Yeah.
So when we get it when we are old, that's not genetic. That's just
Not usually.
We're going to die anyway.
Unfortunately, we are. That's the one fact about life.
Either you die of this or that or that.
Yeah.
Karen,
Dead in Texas.
Oh,
Karen, I understand there's a blood test that people can take nowadays to determine whether you can get Alzheimer early or something.
blood test.
I thought I heard somebody was saying.
My son-in-law was.
You had the very rare type, isn't it? Yeah. Not fat. I don't believe we do random blood tests because we do full blood workup when we suspect somebody's got cognitive impairment. The reason being is some of the causes are actually reversible, like vitamin B12, vitamin B1, you know, the sodium. If our sodium and potassium are too low, we become confused. So we always do a full blood workup to eliminate reversible causes because the person can actually get better. So that's what we're looking for. And we also want to improve kidney function because kidney function can make you, you know, confused as well. And yeah, some really rare forms of dementia can be picked up through blood tests. I don't know of Alzheimer's being picked up in a blood test. What we recommend strongly is what's called a PET scan because the brain uses glucose for its energy, and the PET scan actually will show how much glucose the brain is using. And if it's not using enough in certain areas of the brain, we're able to make diagnosis. And that's the test we actually use for Alzheimer's. But getting in to have a PET scan can take 12 to 18 months. It's horrible at the moment. Yeah.
Do they still do mini Mensa?
Oh, yes. Day in, day out. Everybody gets a mini mental. For what it's worth, my mum knows the answers, so it's pointless giving her that one because she's done it so many times. It's in a long-term memory. It no longer tests her short-term memory because she's done it too many times. And she actually rehearses the answers before the people come. But the mini mental is only a screening test. It's not a diagnosis. It's just a cause for alarm if the score is on 20. Look, if it's 23 to 26, out of 30, we start to go, uh-oh, and that will make us do additional testing. If it's well under 23, we pretty much know what we're dealing with. But the thing with the mini mental, it doesn't test the front part of the brain. So it doesn't test planning, problem solving and all those things which are indicative of frontotemporal dementia. So they slide under the radar with the mini mental, but it's what we use. And you do it every time you see one of us, for the first time anyway. It does give us a pattern over time if that score changes, so that is its advantage. Any other questions? Up the back.
You use two terminologies. You said Alzheimer and dementia.
Yep.
I want to know the difference, and then also another question. What's the difference between dementia and multiple sclerosis, and which one is worse?
They're very
One more
different.
thing is when you talk about the front parts of your brain, are you referring to glials?
Am I referring to?
Glial.
Glials, it just knows glials, dendrites, neurons,
Ah,
and synapses. So
They're all through the brain.
And electrical.
Yeah. Cells are all through the brain and they all interconnect. All the different brain regions speak to each other. Dementia is a global term for anything up to 100 different types of illnesses that all cause dementia. Alzheimer's is one of those. Vascular dementia is another. Frontotemporal dementia is another one. Lewy body dementia, Parkinson's disease. Multiple sclerosis does have a dementia associated with it, but not everybody gets it. Only a small percentage get it. And multiple sclerosis is a completely different illness. It's about the myelin that wraps around the cells to make the nerve impulse travel down the cell quickly. That breaks down, so the impulse goes too slowly, whereas dementia usually means death of cells. So it's quite a different process.
Which one is worse?
I don't have either, preferably.
Yeah. Karen, can I just ask one question? If someone needs assistance, with referral and all that, or help, or treatment, what is the best way to go?
So over there is a brochure with a whole range of phone numbers on it, so depending what the issue is. If it's early dementia and the person's just getting lost and having trouble with wayfinding and memory, the two organisations are Dementia Support Australia and Dementia Australia, and you can get help for your loved one. You can also get counselling and education for yourself. If it's moderate to severe dementia and the person is aggressive, or they're paranoid, or they're profoundly depressed, or very, very agitated and distressed, they're more likely to come to us on the age psychiatry team where we would see them. So we deal with the much more severe components of the dementia process for those individuals who experience it. So we've got a heap of handouts down on the end with phone numbers. We made 40 of everything, so feel free. I hope that's enough.
So Karen, in your treatment, when they come to you, what do you do with them?
What do I
treat
do
them?
personally?
Yeah.
A lot of my work's in nursing homes and with families. So what I'm trying to get the person doing is re-establishing a daily routine, so they're doing all their normal activities again. If they've got symptoms of anxiety, teaching them different ways to manage their distress, despite the fact that their memory is poor. We use more sensory stuff like weighted blankets and calming things. I work with the carer on the best way to communicate and work with the person with dementia. In nursing home, I might teach them flatly how to communicate, how to speak, how to work with somebody, how to change somebody so that the person doesn't get agitated and distressed. So every client's different, so it depends what the need is.
So there is it's always continuous, there's no end to that treatment.
There is, we're a very short-term service. It's usually 6 to 8 weeks. Sometimes it's a bit longer, but because mental health is very under-resourced, aged mental health is the bottom of the pecking order of mental health. If we had the funding for the geographical area that we support, we would have 60 plus staff. A year ago we had 18. With the Royal Commission, we have got extra funding to go up to 30. It still won't meet the need. So it is what it is.
Yeah. Unfortunately, we have to draw it to a close. We are gone for an hour. It's information overload, huh? But there's a lot of information over there because not everyone is relevant to everyone. It's a huge topic. There's so many questions. Thank you so much for being so informative. Yeah. Thank you so much. And we will have lunch as usual. Yeah, a token of appreciation. I think Polly has something for you. Karen, thanks so much for coming around.
Oh, thank you.
Lunch is served, no?
Yeah.
Yeah. Okay. I will just
Thank you very much. I'm happy to hang around for a few minutes.
Yeah, other people can do it informally. You stay for lunch?
1 point leaflet.
It's available. Yeah.
Do you want to stay for lunch, ladies?
Just a quick pizza and pasta. Yeah. Okay.
That would be lovely.
Okay. I'll just give thanks. Father, we give thanks for this morning. Lord, our information session that we learned so much. Lord, life is full of the cycle of being born and growing old. And Lord, in the process, Lord, we want to have the utmost best. Lord, thank you for this place. We can connect with one another. Thank you for the hands in the kitchen who prepare all the food. Nourish it, cleanse it, so that we will rejoice even in this fun-filled activity. And bless our body too, we pray. In Jesus' name. Amen.
Yeah, if you can be seated on the tables, the food will be served, the main ones. And